Okay, great. Thank you, Olivia. Thank you, Jordan. Welcome, everybody. It is May 6th, and we are entering a new phase of this emergency and the response to this emergency, and we've got a lot to talk about today. We are going to start, because it is Wednesday, with Dr. Leffler, the President and Chief Operating Officer of the UVM Medical Center. Dr. Leffler, thank you for joining us once again. Let's dive right in. we're going to get up here on the screen the graph that we set our Wednesday sessions around, which is the of infections.
Mayor, we're having a hard time hearing you.
Let me, sorry about that.
I think it's the
Olivia?
Yes. I can't hear you, Jordan.
Olivia, do you want me to jump in?
And then we will try the audio.
Yes, Dr. Leffler, why don't you jump in? That sounds great.
Okay, I'll start. You can hear me okay?
Yes.
Okay. So continued very good news for the state of Vermont, Chittenden County and the city of Burlington on COVID cases. The graph pretty much tells the entire story. So in the whole state of Vermont, yesterday, there was only 2 new positive cases. That continues a very good trend over the past couple of weeks, which we'll talk about why that's important in a second. We remain pretty steady at a total of 52 deaths. That's number's been right there for about a week. At the University of Vermont Medical Center today, we only have 2 inpatients who have COVID-19. We also have just 2 rule-outs, and we have no one that's on a ventilator. We've had no one that's been on a ventilator for more than a week with COVID-19. So that meets many of the criteria we're talking about from a hospital healthcare perspective to allow us the opportunity to think about expanding some of our services. As everyone that's on this in this meeting knows, that in mid-March, with working with the governor in the state of Vermont, hospitals across the state made the important decision to stop doing all elective office visits, elective care of any kind, elective imaging, and elective surgical procedures. And I don't want to minimize it. That's had a big impact on our patients. There's people that have been waiting patiently for care they really need. It may sound elective when you say what the case is, but if you're someone that's home in pain or really waiting for something that needs to be done, they've had to put that off for 6 to 8 weeks. So we are very excited that the current situation for COVID-19 in the state of Vermont and in the hospitals across the state is such that we can start to gently and carefully resume elective care. So along those lines, the hospitals across the state, the UVM Health Network and the medical center have been working with the Department of Health and the governor to come up with some criteria around how to begin providing elective care. Elective office visits can resume immediately. I will tell you that we were doing and are continued and will continue to do a lot of telemedicine visits. That's great for our patients and our providers. And there's not much good that comes out of the COVID-19 crisis, but we got pushed into doing a lot of telemedicine visits, and our patients have loved it, and we're not going back. So that's a new way to provide care to people who need it without having to drive a long ways. It's efficient for all involved. So we will keep doing a lot of telehealth visits. But starting next week, next Wednesday, the medical center will resume outpatient surgeries at the Faneuil Island campus. We're going to start slowly. We're going to do 2 cases on Wednesday, 4 to 6 on Thursday, 4 to 6 on Friday, and then gradually ramp up from there. I want to be really clear to people that we're doing it. It will not be back at full capacity for a long time. We're going to make sure that we socially distance our patients, our staff, we keep the rooms separated apart, and we do everything that's critically important to keep everybody safe. So we have a very careful screening plan for our patients. We'll also be doing testing on our patients before they get the surgeries, and we'll be doing, I would say, surveillance testing on staff as well to make sure that we provide the care completely safe to the people that we're serving. Because it keeps coming up, I just want to remind people we are still open. We have been providing emergency care throughout the entire COVID-19 pandemic, and I want to encourage people that think they're having any kind of emergency to seek care. We are seeing people that are showing up that are very, very sick because they were afraid to come. And we do not know of any patients who caught COVID-19 while in the hospital. None. So if people are sick out there, they need to get in and get care before they get sicker. Working with the state, we believe that we'll be back to doing inpatient elective care. So that's more complex things like total hips, surgeries like that, within maybe 2 or 3 weeks. We're working our way a plan back for when we exactly start that. And we have a good, clear plan in place for personal protective equipment for the staff and how to test everybody. That leads to my next update, which is testing. We talk about testing at every one of these sessions. So testing remains in pretty good shape in Vermont. We have enough tests for everybody who needs it right now. Because we're not testing a lot of people who are presenting with COVID symptoms, it allows us to do some surveillance testing and check some other populations. And there was an announcement out from the Department of Health yesterday that people who have even what might be considered to be mild COVID symptoms can get tested now. So I think that enhancing our surveillance will give us better numbers for who out there still has some virus, and it's part of this next phase that we'll talk more about. As we think about starting to resume some elective care at the hospital, the same criteria we use to think about that, I think, is the same criteria that our cities, towns, the state, and our businesses are using about how they would do the same thing. Our future for the next 1 to 2 years, I firmly believe, is that COVID will be with us. At times, they may be with us in very small amounts. At times, we may have little spikes and surges. So we have to build a model for healthcare and for our communities and schools and businesses that can deal with that and is responsive to it. So we're building a model. So we expect to have some COVID people in the hospital. We're going to maintain some extra spaces in our ICUs for that. We're going to do less than what we could do full capacity of different kinds of surgery. So we're not filling the hospital in case we get a surge. We're going to maintain some of the good work we did around keeping our staff as safe as possible. So we're not spreading it that way. But we really think over the next 1 to 2 years that we have to be prepared at any time to see an uptick in cases. Maybe not a surge where we'd have to open up another site, but you want to have that planned for as well. So we use the mitigation time as efficiently as possible, so we're ready for whatever comes going forward. So I'll stop that there. I'm extremely happy to have Dr. Moreau or someone ask questions.
Great, Dr. Leffler. Thanks. Hopefully we got the audio issues figured out. And some really important updates there in terms of what's going on at the hospital. I want to make sure anyone listening really heard clearly that point. I have sensed some of this out there when I've been at a mass distribution sites or elsewhere talking to Burlingtonians. I just want to hear, if you should not be afraid of the hospital kind of procedure, you should not.
Mayor, you're still going in and out. I don't know if there's anything else we could try for the audio.
Yeah, I have one more point I could make while you guys are working on that.
That sounds great, Dr. Leffler.
Yeah.
Yes.
Okay. So the one other point I thought would be important to make right now is as we think about starting to open up everything a little bit, is we have to be very cognizant that there's still significant risk to vulnerable Vermonters. And vulnerable Vermonters are people who have other kinds of illness. They may have cancer, they may have something that makes them immunosuppressed. They may live in group settings. Nursing homes are good examples. And so this model that how we live for the next 2 years has to be very thoughtful about doing everything in our power to keep that population safe. In a perfect world, we keep them all safe until there was a vaccine. So that's really how we have to think about this, that we're going to do things to really protect our vulnerable Vermonters while we start getting things opened up some. And we are also spending time talking about that for our patients that we discharge to home and other settings. So I'll stop there.
Thank you, Dr. Leffler.
Olivia?
Yes.
Great. How's this?
I can hear you.
Perfect. I'm going to switch the computer around. Sorry about that, everybody.
All right, we'll try again here.
Great. I can hear you now, Mayor.
What's that, Olivia?
I can hear you now. Good.
Okay, good. Dr. Leffler, so hopefully people heard you on the updates as they apply to the hospitals, which are really critical and many people I think are very focused on. Just to extrapolate out a little bit, because I think what you're describing at the hospital and how you are thinking about how the hospital operates has some broader lessons to it, and really I think mirrors the way the city is thinking about how we go forward with resuming municipal services and other elements of activity here in Burlington. So first of all, looking at the numbers, what that graph really shows to me is that we are way down from where we were about a month ago. The peak infections and hospitalizations are some weeks behind us, and that is critical because one of the conditions for thinking about restarting activities in a broader public is there's this standard that I think has some real consensus around it: 2 weeks or more of very low and declining infections. And this is hospitalizations. There's a very similar graph on the dashboard that shows the new infections. I think we've met that standard. We're past that standard in terms of a couple of weeks of good outcomes.
Fully agree with you. So 2 weeks is not a totally random number. We know that people carry the virus or can be infectious with minimal symptoms up to 2 weeks. So I think it comes from there. But we have had now really 2 steady weeks of seeing numbers drop, of having our hospitals not have very fewer or no COVID patients, of having our ICUs not full of COVID patients. So that really allows us to start thinking that we have capacity at the hospitals to do more. And I mean, one of the ways to think about as we start to resume slightly closer to normal activity is the hospital has 8,000 employees, and oftentimes between employees and people here, we're like a small city in some ways. And so we're a microcosm of the kind of things. We have cafeterias, we have a lot of services. So I think you could think about what we're doing and then expand it out to a broader scale, like a city.
Yeah, great. So, all right, so that's sort of the numbers and the infections criteria. Another standard that there's pretty broad consensus of to think about restarting has to do with the hospital itself and the healthcare status. So hearing you describe how the hospital is in good shape right now, and you have some confidence about the ability to move forward is really encouraging. That includes, Dr. Leffler, right, in terms of having PPE supplies for the indefinite future. That's what you're describing, right? The hospital is ready for what may come at it if we were to go into a new chapter and start and do some restarting activities.
So the big 3 things are: we have ICU capacity for patients who need us, both with COVID and otherwise. We have adequate PPE to start doing surgery. So one of the key reasons we stopped doing elective procedures for 2 big reasons. Number 1 was for social distancing of our patients and staff. And number 2 was so we wouldn't burn through PPE for patients who didn't have or were at risk for COVID-19. We have a very thorough eye on our PPE supplies right now. We're getting daily updates on how many days we have on hand of all these different supplies. And so that will also help inform our decision about how much elective surgery we're able to do, is how many gowns we have, how many face masks we have. And we have a good supply right now. It's not unlimited, but a good supply. And we have good information that more is coming. It allows us to safely start doing those procedures. But like I said, we're always assuming when the next little spike of COVID comes. So we want to make sure that we build both COVID cases and normal care into our models.
Great. And then the third big criteria, as I'm coming to understand it, for being ready to try restarting, and we'll talk about what we mean by restarting in a second, because I don't want want people to have the image of like a light switch being turned on. That's not what we're talking about at all. But before you can really move in this direction in any material way, we also need robust public health capacity is the way some people describe it. Other times on this briefing, we've talked about this term that's I'm starting to see more often, TTSI, testing, tracing, and supported isolation. And we've in past briefings, it's a big conversation, and I think we need to talk more about it. And I don't think we have time to do all of that here, but the part of that I think is most directly in the hospital's kind of bailiwick is the testing piece of it. While we were having the audio issues, I think you gave people a good update on the testing. That is really, I think, when people are trying to understand why can we be talking about restarting now when we were not at all ready for this conversation 2 months ago. That is just a huge difference between where we were in mid-March versus where we are now in the testing capacity and what that means for virus suppression efforts, right?
There was a day in mid-March, around the 18th or 20th of March, somewhere in there, we were down to 2 days of testing supplies. We literally were down to the point where we thought we were worried about getting through to Wednesday. And through great collaboration, which we've already talked about on this call in the past, we got over that hump. And then our testing capacity has continued to improve. And we still don't have unlimited testing, but we have more than enough testing now to start doing testing and tracing, and more than enough testing to start doing some targeted surveillance. And so we needed that amount of testing to be able to start doing elective surgery. It's part of the plan for how we're going to do the surgeries. So we're in a good shape now on testing. And I really think that, I've been saying this for weeks because it does get better every week, that every single week now, our testing supply chain, so getting enough tests, kits, reagents, people to run the tests, where to get results back, is improving almost every day.
Okay. Well, Dr. Leffler, thank you. I wanted to take some time on that and just lay that out because I really want the public to understand that as these conversations about restarting activities happen, I know there's a lot of hopefulness about those conversations. I know there's a lot, people are hungry to get out of their homes, to do more, to see elements of their old life return. People want that. At the same time, I know there's a lot of apprehension about it. There's a lot of concern. We've gotten a little bit used to this current posture, and to start thinking about, I've been talking more about this in recent days. A lot of people have been saying to me, why now? I think this is the answer to why now, in part, is really in full, is these three things have changed. One, the amount of new infections is very low and declining and has been for a substantial amount of time. Two, the healthcare system, the hospital is in good shape, well supplied, ready to take on the challenges of the next phase. And three, we have this public health infrastructure that didn't exist at all in mid-March, or barely existed in mid-March, is now in a much more robust state. So thank you for working that through. Do you have some final thoughts? And then I should move on to some other elements of the briefing.
Yeah, so I think you summed it up extremely well. And I couldn't agree more that it's not going to be a light switch where everything starts up. I think of it more as a dimmer switch. So if you say we were, close to dark, it's going to be a little bit of low-level moonlight coming back. And then as we navigate through that, we will get better at that. We'll be able to carefully track cases and see what's happening, and then keep turning the lights up a little bit at a time. So thank you. Have a good week.
Okay, Dr. Leffler, thank you. Great to hear from you, and we'll talk to you again soon. So I'm going to kind of build off of that with some further remarks about restarting activities here in Burlington. So we're really coming towards the end of 2 months of collective sacrifice. We've flattened the curve of this first wave of COVID-19 infections in the community, as we've just been looking at. And I do want to just acknowledge what a significant achievement that is, and the collective nature of it. When we started this back in March, it was unlike anything that any of us had really lived through, and there was great questions about whether it was something we were going to be able to do. And I hope when people see that graph we had up there a moment ago, or ones like it, they feel a sense of pride and a sense that the community has risen to this first part of this challenge. We have a long fight ahead, as I've been saying for some time. We should take confidence and hope as we go into that fight with how significantly we've succeeded in many ways in this first phase. The governor has, for a few weeks now, been doing what he is calling quarter turns, or one time, I think one Friday, he called it a 1/8 turn of the spigot. And there was some further loosening earlier today that will have some direct impacts on some of the Burlington actions we're going to talk about in a moment. And that is what the weeks ahead are going to involve, is further turns, and we're going to do these quarter turns of the spigot here at the local level. I want to be clear that as we do this, we're going to continue to put public health and safety first. The steps that we have taken to shut down our schools, our restaurants, and many other parts of our society have been wrenching decisions, but they were necessary because, until now, we didn't have the public health infrastructure we've just been talking about with Dr. Leffler, and the medical surge capacity that we needed. That has now changed, and that puts us in a different place with respect to public health. The data is showing us, again, that we're in position where we can slowly and carefully take a few deliberate steps out of it where we are now. We've got to do this. These steps are needed for our collective physical, emotional, and economic well-being. To all of those who have lost jobs, who struggled to pay rent, or seen their life's work or their family's livelihood crumble, I very much recognize that the public health and safety have been intertwined, and there's been a huge economic impact of this crisis. Going forward, these public health and economic indicators, public health and economic recovery, are going to stay very much intertwined. And really, success on the public health side is what is going to be essential for the return of the economy and for activities to resume. These are not goals that are in tension with each other. They are very much linked. So I think we've got a slide here that I think does sort of summarize the moment we're in well. And we kind of have been covering the when side of the slide with Dr. Leffler. When to restart or try to restart. And again, we hit each of those three elements on the left-hand part of the slide. So let's move our attention now to how we restart. How do we lift physical distancing restrictions? And what are essentially the principles and the big picture concepts that we're going to try to keep in mind as we start to do that? Let's talk about each of those there a little bit. As we restart activities, there is going to continue to be a group, and Governor Scott spoke to this earlier today, a medically vulnerable group that is going to need to, that we're going to need to continue to protect, and that is going to need to continue to be very careful. And later on in my remarks today, we have some detail about how we're going to do that. We are in our incremental steps forward. We are going to prioritize those activities that have the greatest societal benefit, and sort of a subset of that is activities that we are most confident can be done safely. And then third, we need to have in mind as we go through this that the public needs to know that government is watching very carefully, watching very carefully the rates of new infections, watching what is happening in the hospitals, graphs like the ones we saw earlier. really trying to carefully, in a real time, on a daily sense, know what is going on and be able to be confident that activities can continue because what we're seeing with that monitoring. So let's turn now, Olivia, let's go to the next slide and let's talk about some specifics about what these incremental restart activities are going to look like over the coming days and weeks in Burlington. First of all, I want to talk about the changes that people can expect most immediately and that I think are going to be very much welcome, and there's a real hunger for that, which is we are going to start reopening our parks facilities. So with the new guidance that was announced by the governor today, and that we have been in conversation with the governor's team, and we're very hopeful that these announcements would come today. We are going to be able by this weekend to reopen our dog parks, our tennis courts, our pickleball courts, and the skate park. The skate park was shut down last weekend. It was something we had hoped to avoid. I'm happy to say we are going to be able to open that. All of these are facilities that have been closed up until now, but that really don't, they're considered low contact and that they can be done, that those activities can be done safely. We are going to be removing the closure signs. We're going to be putting nets back up, unlocking gates, and there will be some new signage going up at the dog parks and perhaps elsewhere with guidance about how to, what activities should look like in this new phase. We do want to point out that at least for the time being, and we'll keep working on this, that basketball courts and playgrounds are going to remain closed. The governor's order may give us some flexibility in the weeks ahead for basketball courts, but the guidance continues to restrict any kind of contact while playing basketball. We experimented with this earlier in the emergency, and there really wasn't a good way for us to have the basketball courts open and to have no contact happening on those courts. So we're going to keep looking at that, but for at least the time being, at least this coming weekend, the basketball courts will remain closed. Playgrounds are not yet on the list of facilities that the state guidance is allowing to open. Working with that kind of framework we talked about before, why is this an activity that makes sense to have it as an early part of the Burlington restart? Well, having these facilities open has high value. We know there's a great desire for activity, for exercise, and these are all outdoor activities. And the science is not definitive yet, but increasingly there is this sense that outdoor activities are far safer than other types of settings, and that outdoor transmission is, the studies so far have suggested that there's much less risk of outdoor transmission than indoor transmission. So these steps are in line with that science and that way of thinking. Next, we want to now turn our attention a little further out, but I think it's important that we start speaking about this today because I know a lot of people, a lot of organizations, a lot of parents have questions about what the summer is going to look like in terms of our kids. And the governor's new guidance today does not directly speak to this, and we are not totally sure. We're expecting new guidance relatively soon, but I think we've reached the point here in May 6th where it's important for the city of Burlington to signal that even though we don't know exactly what that guidance is going to look like, we are, as a city that runs lots of youth camps through our Parks Recreational Waterfront program and through our library and through our Burlington City Arts Department, we are planning for a full summer of youth programming. The camps that will almost certainly be altered versus what exactly that program has entailed in past years. There will probably be less field trips. There may be differences in the way different kids are allowed to mingle. We may try to have kids in smaller cohorts we haven't figured out those details, and we're not ready to announce them. But what we do want to be clear about is, if conditions allow, if things continue to head in the positive direction that I was talking about with Dr. Leffler before, and if the governor's guidance supports it, we will be running these camps throughout the summer. And parents should know that and have some confidence in that as they're thinking about how their summer is going to be planned out. In addition, I want to take this step and make it clear we're doing this because I know there are many other organizations in Burlington, in the region, that are going through their own analysis, questioning whether they can be open, whether it is going to be safe for them to operate their summer camps. And in fact, we know that some, particularly overnight camps, have had to cancel already. And I know, again, there are many other organizations that are kind of trying to figure it out. I want to say two things to those organizations. One, the city of Burlington is optimistic we're going to be able to do it. Secondly, if you want help sorting through the state guidance, if you have questions that we can help you get answered, get in touch with our Resource and Recovery Center. We have a very good channel of communication going there between the Agency of Commerce and Community Development and the RRC, and we love the opportunity to engage you, make sure you have full information, and help you get answers to questions that we can't immediately answer as you're sorting out these conversations. I think if we can find a way to have as much youth programming going as is safely possible this summer, it's going to be really good for the community. It's going to be good for our kids who have been, pent up in our homes and have had really limited enrichment opportunities. They will really benefit if they can have full summers. It will also be good for parents who have had to curtail their work activities or their other commitments because they've been so focused on childcare. This is a high impact. Again, going back to that kind of framework at the beginning, this is an area where if we can get this activity restarted, it's going to have high societal value. And that's one of the reasons we're so focused on this. We're talking about it today, even though there is some uncertainty about exactly how this is going to play out. So that's what we have to say about that for today. More details in the weeks ahead as we have them. And then finally, looking also out towards the end of the month and into the summer, I want the community to know that we have established a working group of city staff that is in consultation with the great dining restaurant community that we have here in Burlington that is looking to put together a streamlined application process to allow retailers and restaurants to use outdoor space like city sidewalks in order to reopen some business activities this summer. Again, why are we doing this? Well, going back to that science I was referencing earlier, it really appears there's a growing body of evidence that outdoor activities are significantly safer than indoor activities. We have the best months of the year coming up, and we really want to see what we can do to use the public right of way to make more of these activities that have been so severely curtailed in recent months possible during the warm weather months and during the summer. So we have a lot of details to figure out here, and the state guidance, again, doesn't support any of this starting today, but we're hopeful that will be clarified in the weeks ahead, and we want to have a plan in place by Memorial Day weekend so that retailers and restaurants that are interested in spreading out and having more outdoor activities than they have in the past will have a clear way of applying for that. We'll have a clear way of sorting through any possible conflicts or issues that might create, and we'll have more details about how this would would actually work. Where we've gotten this idea in part by, again, looking around the world and seeing that there are a few places in different parts of the world that are having some early success with these strategies. It seems to fit with the science. And again, this would have a high positive impact on parts of our community that have been really devastated by the early stages of this emergency, and might stem some of the economic damage that we are incurring right now in those sectors. As we do that, and I want to close and emphasize, as we pursue those restart activities and more in the weeks ahead, I want to be really clear that we are going to continue to relentlessly protect the most vulnerable members of our community in this emergency. I think Burlington has approached this emergency with a spirit that no one should be left behind. And I think we have a lot to be proud of about how we have done that in the opening weeks. And we, just to recap, Olivia, I just want to make sure we've got the slide up here. So one of the things that we've been trying to do throughout, and we're going to formalize and kind of codify in the weeks ahead, is working really closely with the group that appears to be the most medically vulnerable, these nursing homes and other sensitive housing communities. We are going to create a task force to ensure that the city and these senior providers are in good coordination and good touch on a weekly basis as we enter this next chapter of the emergency. There needs to be very strong protections in place for these high-risk populations, and we're going to have this additional working group to make sure that stays there. We have started this Trusted Community Voices program. The group has started to meet. I got a chance to have a briefing with them last night. This is a effort to ensure that the new American communities in Burlington are fully briefed on the opportunities and the resources that are available to them during this emergency. That effort is off and going and will continue. The effort to put high quality, reusable, durable, washable masks in the hands of all essential workers who want one is basically complete. The Resource Recovery Center can still respond to any further requests that there are. The way in which the community has worked to protect the homeless during this emergency that requires everyone to have a home has been pretty remarkable up until this point. And it's not going to end as we head into this new chapter. We are in communication with the state, and the state has plans, even as we transition out of this first phase, to continue to keep additional resources available to support homeless population. And the city in particular continues to work on figuring out what will happen with the low barrier facility that is currently set up at North Beach. We are working on both immediate plans and medium and really long-term permanent plans for improving those low barrier services. As we enter this next phase, I want to explicitly acknowledge that while I think all of us are hopeful about what this could mean, and there are certainly things that all of us miss about our former lives that we're eager to get back, could be coming incrementally in the weeks ahead. it is also really clear that this next stage has new risks, and in particular, these are they're risks for vulnerable communities. And those, when I say vulnerable communities, that includes everyone from these elderly communities and medically sensitive properties to other populations that we know have been hit very hard nationally in the early stages of this emergency. We know people of color in particular have had a disproportionate burden, have had a disproportionate number of negative impacts and frankly of deaths in the opening months of this epidemic. So, you know, I acknowledge and understand fully why there would be some real concern and skepticism within vulnerable populations about how this is going to unfold and what this next chapter will mean. I think what I want to, you know, what I'm trying to signal here today is how aware the city of Burlington is of how unfair and disproportionate the negative impacts of this emergency have been nationally. We have been aware of that since the first days of this. We have been trying to combat those disparities and inequities. And as we enter this new phase, we are redoubling. What more should we be doing? What more are other cities and other communities around the country and the world doing to make sure that everyone is protected, that the most vulnerable are protected, and that we continue forward with this ethic that we are in this together and we are going to get through this together. I think a little bit with Dr. Leffler, and it was pointed out in one of those earlier slides, this may well not be a linear process. The loosening today, which we hope and expect to continue to include more and more activities as we've been discussing, may not always be linear. There may be times when that loosening of the spigot has to be reset into some kind of tightening. We are certainly anticipating that this pandemic could follow the pattern of others where there are future spikes. We are going to do everything we can to be ready for that. That is the whole point of this robust public health infrastructure that we'll talk more about in other opportunities. And in fact, one of the last things I think we want to announce today, I'm not sure if it's up here on a slide or not, is that we are planning another telephone town meeting for within the next week, as we are, again, we had one of those community conversations just as this first phase of the pandemic was beginning back in mid-March. We think it's time for another community conversation like that, and we'll be releasing details on a telephone town meeting soon. All right, I think with that, another restart initiative that we wanted to highlight, and I think we have our library director, Mary Danko, here to speak to, and there she is the return of outside pickup service. Mary, welcome. What can you tell us about this? Mary, you're, there you go.
Am I on? Okay. Am I on? There we go.
You are.
Okay, thanks. Yes, so it's starting tonight. So we've got our schedule, and you can put books on hold through either our catalog. So you can go on, use your library card number, log in, put things on hold. If you don't have access to a computer or you don't want to do it that way, you can give us a call or send us an email. And even if you don't even know what you want to read next, you know, librarians are there to help with book recommendations. But basically, once you start putting things on hold, you'll be able to pick them up, and you'll get notification when your book is ready, and it will be on Wednesdays from 4 to 8. And then Friday, Saturday, Sunday, and Monday from noon to 4. And it's really simple. We're really excited to see everybody. I think we've been hearing from people that they're tired of looking at screens. They're tired of being on Zoom, and it's nice sometimes just to read a book. So I think it's great that we can be outside reading books, with this great weather. And the other thing we've been noticing too is that families are reading together, so they might read out loud, and it's a great way to have enjoy stories together as families.
All right, Mary, that's great. That's great news for, I know Ada's been eager to get back to refresh the library books. It's been amazing what you guys have done on the virtual. I think all of us are thirsting for more of those non-virtual resources. So thank you for moving so quickly on this, is basically making it possible almost as soon as the guidance changed. So good work.
We're excited.
And the final item, and then we'll open up for questions. The Fun at Home resource of the day. This is one I really everything that the team has highlighted in this segment have been great. This is a particularly special one. Every year, the Burlington City Arts has this event for 33 years. We've been having this event called the Children's Art Exhibition. It involves fourth grade art teachers from all the elementary schools, working with their students and selecting, working with really a large number of students, hundreds of students across the city, to put forward their best works of art. They get displayed here in City Hall for weeks in the lobby. And there's always been this great, very well-attended event in Contoy's Auditorium. It's always one of the busiest events of the year, with parents and grandparents throughout the floor and up in the balcony. And it's always really a happy day. That's just one of the events that had to be canceled as the pandemic hit. The DCA team has found this great way to make it possible for the whole community to enjoy this art and really kind of experience some of the fun of that annual event. You can see the web link there online. Go to the BCA website, and there is a great video, and all of the works of art are on display there. And so I hope that link gets shared far and wide. The students who work so hard on the art deserve it, and it's a chance for the community to see what a great job they've done. With that, I think we'd be happy to take some questions, Olivia, if there are any.
We do have a number of questions. The first one is from Liam from VPR. His question is, with the governor relaxing some social restrictions combined with the good weather areas of the city, like parks, the bike path, beaches, I expect we'll see more people out and possibly in larger groups than the governor's order allows. Will you close these public areas if people aren't following the governor's order?
Well, first of all, I was out a lot this past weekend, and I got to say, what I directly observed is that there were many members of the public who seemed to understand the guidance and were working hard to observe it. And I think the results back that up, that in general, the response of the public to the guidance coming from the CDC, to the guidance coming from the state, to the requests that we as the city of Burlington have been making have been exceptional, have been outstanding. That we are better than most places in the country in terms of being ready to start these restart activities, and the public deserves all the credit for that. So while certainly it is the case that there are outliers, there are there has not been 100% compliance. I expect we would continue to try to approach that outlier behavior the way we have really since the beginning, through education and engagement. We will have city police will continue to be out there. There will be some park staff, and we will be engaging people and trying to make sure that people understand the regulations and observe them. Regulations now in place are looser than what they have been up until now. And so, I think you will see people adapting to that. I've been stunned, frankly, how close it seems to me large numbers of the Burlington public and the Chittenden County public, how closely people have been observing the guidance. The observation I had, there were very few people that were wearing face masks in the Burlington area until the day after the governor and the health commissioner said it's important to start wearing face masks. I overnight almost saw that uniformly. I think it has gotten harder to keep with the compliance in some ways as things have gone on. But I think the results speak for themselves. Things are going well right now. I'm not wanting to close down areas again, to directly answer your question, Liam, unless we have to. I'm excited that we are in a position that we can be loosening the rules here and allowing some additional activities to take place. We are going to continue to expect and educate people on what type of activities are appropriate and what are not. I would not see us closing public spaces unless we had to, unless we were seeing an indication in the numbers that things were starting to head in the wrong direction.
Reminder for members of the media who are tuning in to submit your questions by emailing them to me. Next question is from Aiden at VT Digger. His question is about the Memorial Day weekend kind of time frame on the slide about outdoor business activities. His question is the city aiming to have restaurants and retailers reopen in some capacity on Memorial Day weekend, or is that the deadline for the city to have a plan prepared for that reopening?
Yeah, no, thank you for that clarification, Aiden. My point there is this is going to take some effort, and there's two, the process of allowing private businesses to use the public right away. This is something we do, and something we've done more and more of in recent years. And when I say over the decades, you go back 20 years ago and there was no outdoor dining on Church Street. Now it's one of the great elements of Church Street, and has been for some time. So this is something we do. There are real issues that need to be sorted out. It's not easy, especially when you have different stakeholders that could be impacted in different ways by decisions. For example, whether or not to designate a parking space, an area that people could dine in. And so the end of the month goal is that we want to have a plan by the end of the month. We want to have that figured out so that we are able to act when the governor and the Department of Health indicate that the guidance, that activity can happen safely. When they, really it is the Department of Health and the governor that has the authority to say whether or not that activity can take place or not. When they do, we want to be ready. And so I hope my intent is for it to be understood in that way. That is not a projection of, I don't have a way of projecting at this point when that kind of in-person dining is going to be allowed. But in anticipation that could happen around the end of the month or in June, we want to be ready to move when it does.
Next question, Aiden and Liam have a similar question about City Place Burlington. So Aiden's question is, does the city believe the start of construction on the City Place project this year is still feasible? And Liam's question is, full construction crews are going to be allowed to resume work soon. Do you know if Brookfield is planning to begin construction on the City Place project this summer?
So it is good news and another sign of improving conditions that construction is now moving forward in a number of areas. I will say, did get an update this morning, and we are hopeful that City Hall Park construction, which was shut down for the winter, will resume this next week. That would have started before now, but for the fact that we've been, the governor's shutdown order. With respect to City Place, I have several times been in communication with Brookfield during this emergency. It's frankly not been my top concern. We have much more immediate public health and public safety concerns and trying to get relief to people and workers of Burlington. So it is, but I have had a couple of meetings. I think it's fair to say that there has been some impact on that project, like just about everything else as a result of the emergency. At the same time, Brookfield has indicated to us that they see the impact as more of a short-term impact than something that fundamentally changes their perspective on the property. We are working to be able to provide a full update on the project at one of the upcoming city council meetings, either next Monday, the 11th, or the 18th. We'll have a fuller update at that time.
Next question is from Aaron Brown at WCAX. Is the city planning to take down the signs restricting traffic flow on neighborhood streets? If not, why not? So what Aaron's referring to there is the Shared Streets for Social Distancing program.
Thank you, Aaron. So those are temporary steps. They will be taken down at some point. People certainly should not expect them to be taken. People can anticipate they will continue to be there at least through this weekend. I don't think we've made any decisions further out than that. My sense is even under the governor's new direction, new order, there is still guidance to encourage people to spread out while they are outdoors. And I think the thinking behind why we needed this additional space in the public right of ways for walking and biking continues to be there, and I'm not expecting an immediate change. As more of these restart activities happen, as there's more economic activity going on, I think we could reach a place where it would be challenging to keep some of these structures in place, but I still think that's a number of weeks out. People should not anticipate any immediate change.
Great. And that is all the questions that we have from members of the media today. One last thing, I know we talk about this on this briefing a lot, but for anyone who is still looking for one of the free, high quality Burlington community masks, there are a number of other distribution times and locations set up for this week, and more in the works for next week that we'll be announcing soon. So to see the full list of times for this week, you can check the city website just at www.burlingtonvt.gov and navigate to the masks page on our COVID-19 resources.
Great. I'm glad you mentioned that, Olivia. I've gotten some questions out there, particularly about distribution sites in the Old North End. All of those locations for this week are there, and I do anticipate this program will go into at least into next week, as the demand has been really high at these locations. We've given out hundreds of masks at all the events this week. So thanks everyone for tuning in. Our plan is to be back again Friday. We'll see you then, and stay safe and be well. We look forward to talking to you again soon.